So let me start that again. Some important biological facts about natural family planning. And the first one is that the birth passage or the vagina is acidic in its natural state. Now, inside the uterus where the baby lives, grows inside its mother, is completely sterile and must not have any bacteria. Yet the birth passage is open to the outside, is very close to the anus, and when we have sexual intercourse, we don't sanitize. So a lot of bacteria will come into the vagina naturally. So why don't women get sick? Is because the acid will not allow the wrong type of bacteria to grow most of the time, and therefore protects the woman against infection. That acid, however, also kills any sperm that enter the birth passage within 10 minutes. So long as the birth passage of the woman is acidic, she cannot get pregnant because all the sperms will have died. Now, the other thing is that her egg is only alive for one day, 18 to 24 hours. So after ovulation, within 24 hours, if the egg is not fertilized, that is the end of fertility for that month. Therefore, if a woman were to fertilize, to ovulate, while her vagina is acidic, then she'd never get pregnant. The eggs would be wasted. So the question is then, how do women get pregnant? And the way our Creator solved this problem is that somewhere in the middle of the month, He gave the woman a second wetness. So she feels a flow coming from inside through the birth passage to the outside, like her periods are coming, a second wetness. But when she checks, she finds very, very slippery mucus that is clear. So initially, it may look a bit hazy, but it is stretchy between the fingers and very, very, very slippery. And as the day goes by, it becomes more watery, it becomes more stretchy, and even clearer. Then one morning she wakes up and the mucus is gone. That mucus is alkaline, and therefore its first business is to destroy the acid completely so that the acid does not kill the sperm. The second thing it does is that it keeps the sperm alive for about 3 to 5 days. So if a woman has the mucus, it must come first before the egg is released to neutralize the acid, and therefore becomes a very powerful marker of fertility. It tells us that fertility is coming. Now, when we have intercourse before the egg is released, but in the presence of the mucus, the sperms are stored in the cervix of the woman, and immediately that egg is released, the whole mucus assembly forms channels that actually take the sperms all the way to the egg in a very short period of time. So this mucus is the only reason why women would actually conceive. How many days that the mucus lasts? It usually lasts about 1, 2, or 3 days. I'm trying to move this. So the mucus can last for 1, 2, or 3 days. Now, one day of mucus would mean that the woman experiences wetness maybe at about 12 noon during the day. When she goes to sleep, she still has the wetness. When she wakes up the next day, she still has a wetness. And by noon, the next day, it disappears. So 24 hours, one day of mucus. Now, this mucus is very, very different from the wetness of sexual excitement because that one would last for maybe an hour or two and go, and the sensation is not as slippery as a fertile mucus. So it is something that if a woman paid attention, she would be able to notice. Now, from the time the mucus stops being produced, the woman feels dry because there is nothing pushing the mucus down. And for that reason, she feels dryness in the lips of the birth passage. And the mucus takes another 3 days before it is absorbed. So she has mucus lining the whole of the birth passage, but is not flowing downwards. And it takes 3 days before that mucus is absorbed. So for another 3 dry days after the periods, after the mucus, the woman is still fertile. So if you want to know how long a woman is fertile, you take the number of days that she is experiencing the wetness of the mucus, and you add 3 dry days after the end of the mucus, and you discover that the woman is fertile for only 4 to 6 days in a month. Now, if we do a little math and assume that a woman has her periods for 4 days, during which she would avoid sexual intercourse, and then she's fertile for 6 days. And if the baby is small, then the couple will want to avoid sexual intercourse during the fertile window. That gives us a period of 10 days within which the couple would abstain if the baby is still small. Now, if a woman has a 28-day cycle on average, and you minus 10 days, then God gave us 6 days for getting babies and 18 days within which to use the gift of sex for bonding. And therefore, God is very generous so long as we are not greedy. Now, the menstrual cycle then is supposed to be taught to the girl child from the time she starts her periods at the age of 12 or 13. And unfortunately, it is not taught properly because there is a section of fertility in the menstrual cycle is usually missing in the normal teaching of the scientific menstrual cycle. So what I'm teaching you is the correct menstrual cycle. So it starts with the periods, and the periods are marked by the day of flow. So any spotting is considered as part of the old cycle. Any spotting that comes before periods is a part of the cycle that is about to end. The day the woman experiences a flow and would require to wear her sanitary pads, that's the first day of the period, sorry. And then when she wakes up dry, then she would mark yesterday as the last day of her periods. Then there is a period of dryness before the mucus comes. And if she's not dry, she may notice a secretion that is white or off-white, that is pasty. It is cuddy. It feels like it is gummy. It is very different because it is not slippery. Then the wetness of the mucus comes. We get that mucus that is clear and extremely slippery. Then another 3 dry days after the end of the mucus, we still remember that there is mucus inside of the birth passage, even if it is not flowing out. And then we have a period of dryness when fertility is over, and then the menses come again. So this is what women are supposed to be taught from the little girl at the age of 12 or 13. When she's getting her menses, she's supposed to be taught to pay attention to how her body feels before the periods come so that she can foretell the menses, and then to pay attention to how her body feels before the mucus comes so that she can foretell her fertility. And the things that the woman would need to know around the time of fertility is that she wakes up with this beautiful skin tone, no pimples, the face is very clear, and women talk about a glowing face. She's very keen about how she looks. She has this extra energy. She even walks faster than usual. She wants to wear some nice warm colors, maybe something a little sexy. And when you greet her and you're a good friend of hers, she hugs you, and she's very easily arousable and actually feels like having sexual intercourse. So it's very important that we tell the girl child she's extremely, extremely vulnerable during this phase of her cycle. And that if she allows herself to be in a room with a man she cares about, and that man touches her, chances are that she will say yes to sexual intercourse. And this is how most women would get pregnant the first time. And when we ask them what happened, the most they tell us is, I don't know what happened. Meaning nobody ever told them how vulnerable they are during this time of the cycle. It's also important in marriage because the husband should be able to see this season and recognize it. Because if the baby is small, the woman feels like having sex or is arousable, then the gentleman would need to be a little firm and say, it looks like you're in the fertile window and the baby is still small. We may need to wait and see what is going on. So the period the young girl is encouraged to monitor very closely is from the time her menses end, so that she may be able to notice when the mucus starts and when the mucus ends, because those are very, very important times in the cycle. So what she would then chart is the beginning of the periods, then the end of the bleeding, then the beginning of the wetness, the end of the wetness, 3 dry days after the wetness, and then her periods begin again. So this is how girls are supposed to be taught to chart their cycles. And those women who may be on the call who have never had this before, that is how you chart the menstrual cycle. It therefore will have 3 parts instead of 2. From the beginning of the menses until just before the mucus begins is phase 1 of the cycle, and that is the time we are waiting for fertility. From the beginning of the mucus until the 3rd dry day after the end of the mucus, that is phase 2, it is our fertile window. And from the 4th dry day until the beginning of the periods, that is the phase 3, and fertility is over. We're waiting for the menses. If we taught this to the girl child, she would understand how vulnerable she is. She would understand her gift of fertility as a gift from God that she should guard jealously until she's ready to be a mother. And she would also understand that this mucus tells her that her hormones are balanced. So it's not just about children. Any woman who gets her periods all the way to the periods without experiencing this mucus, there is something wrong. The hormones are not balanced, and she may need to be checked to find out what is going on. So this is something we need to get to the primary school books, so that the children from the age of 12 to 13 who are about to get their periods would be able to be taught this and to understand their vulnerability. The part of the cycle from the beginning of the mucus until the beginning of the menses is a very regular 12 to 14 days. But the part of the period from the beginning of the period to the beginning of the mucus is irregular and can keep changing. What does that mean to us? It means that the mucus, the beginning of the mucus, can predict when the periods would come, but the beginning of the periods cannot predict when fertility will come. And that is very important, because the counting of days and saying day 14, day this, has given natural family planning a bad name, because people don't understand that the first part of the cycle can be very irregular. The regular 14 days is also important, because when you mark when your mucus begins and your periods start, you use the 14 days by counting backwards to audit your cycle to see whether you had accurately plotted the mucus. So every time the periods begin, the woman is to count 14 days backwards and see whether the mucus she had plotted, or the time she thought she was fertile, she was actually correct. So it's a very important to understand that. Now, the calendar method, or the counting method, or the so-called safe days, is actually witchcraft. And I am going to teach it to you so that you never, ever use it, because it fails and it gives natural family planning a bad name. Okay? So the commonest cycle is 28 days and very regular. This is not the normal cycle, it is the commonest cycle. Day 1 is the beginning of the periods. Day 28 is just before the beginning of the next one. And this red line here is the duration of bleeding. We have just learned that if the bleeding starts today, you count 14 days backwards to be able to tell when ovulation happened. In a 28-day cycle, you'll find day 14 is day 14, whether you count from the beginning or whether you count from the end of the cycle. And this is what gives the myth that women ovulate on day 14, which is not always true. But we know the woman is fertile for 3 days before, from the beginning of the mucus. She can be fertile for 3 days before ovulation, and she can be fertile for another 3 days after the end of the mucus, which may happen after ovulation. And that gives a period of 6 days in which the counting method calls the fertile window. So couples are told from after the end of your periods, you can have sex up to baby day 9, then you skip to allow the fertile window to pass, and then from day 19 up to your periods, then you can continue having sex. Unfortunately, this is on the assumption that every cycle will be regular, which is not always true. Now, if the periods of a woman start today and she is so stressed that her periods are going to come 21 days instead of 28 days, which means they are going to come 1 week earlier, her periods have just begun, so she does not know this cycle is going to be short. But if we count 14 days backwards in a 21-day cycle, it means that month she is going to ovulate on day 7 and not day 14. Her app will tell her that she is not fertile, but she is going to get pregnant because she has actually ovulated. What if she is stressed, but this time her periods will come 1 week late? They have just begun, so she does not know they are going to be late. And if we count 14 days backwards in a 34-day cycle, it is day 20. She is going to get pregnant, yet her app is telling her she is not fertile. But because the mucus is present, she is actually fertile and she's going to get pregnant. This is why counting is witchcraft, and nobody should ever teach it and nobody should ever practice it. Now, if a woman is breastfeeding, the last bleed she experienced was during the time after birth. She's waiting for her fertility and therefore is waiting for the mucus. 3 months later, she still hasn't noticed her periods, but she knows she should wait for her mucus. 6 months later, she's waiting. She still hasn't noticed the mucus, and then her mucus comes. If she has been trained to know that the mucus is the sign of fertility, then she would make different choices. But if we teach her to wait for periods to count, then this woman will be waiting for her periods. And because fertility will come before the periods, she actually gets pregnant while still breastfeeding. This is the danger of counting or the calendar or the safe days, and it should never be used. It is not scientific. So we come back to our cycle and we ask ourselves, when we want to have a baby and when we want to space the babies, there are certain important rules. Now, the fertile window is this one we have discussed. It is 4 to 6 days. It is from the beginning of the mucus until the 3 dry days after the end of the mucus. So it can be 4 to 6 days depending on how long the mucus lasted. If the mucus wetness was only 1 day, plus 3 days, that gives us a 4-day fertility for that month. If the mucus is there for 3 days plus 3 days, we get a 6-day window of fertility. This is the time that couples can use to get their babies. So if the husband lives in Mombasa and the woman lives here in Nairobi, and she notices her mucus on Tuesday, it means by Saturday when the husband is coming, the fertile window will be over. So this woman needs to be given off duty to get into the SGR and quickly go to Mombasa and spend the next 3 or 4 days there, then come back to Nairobi and she'll be able to achieve her pregnancy. Now, if the baby is small and the couple want to space the children, then the duration, the period when it is infertile is from the end of the mucus, from the end of the periods to the beginning of the mucus, and from the end of the mucus, the fourth dry day after the end of the mucus to the menses, are generally considered infertile days. But it is important that the couple understands that there are important rules they must obey in order for them to use this method carefully. So any time after bleeding, then we are waiting for fertility, regardless of whether that bleeding is in the middle of the cycle, or regardless whether that bleeding is after delivery of a baby, or it is normal menses, or it is an abnormal bleed in the middle of the month. So long as the last thing the woman experienced was bleeding, then we are waiting for fertility. And it is important to be able to abstain periodically. And these rules have been called the early day rules. The first two rules are very important to make sure that the couple does not have sex while the mucus is present and yet they do not know it is present. Rule number one, no sex in the morning. And when we say no sex, we mean no genital contact. And this is the reason. The mucus is so particular about delivering the sperm to the egg that it is unforgiving. And women have gotten pregnant without having sexual intercourse. So if a woman is wet with that mucus and her panty is wet with that mucus, and she allows her male friend to play around that area and he ejaculates, that mucus will take that sperm all the way to the egg and the woman will actually get pregnant. So it is important for couples to understand that when we say no sex in natural family planning, we mean no genital contact. Do not touch. All right? So no sex in the morning. So everything happens in the evening. Now, why would anybody give such a rule? We are using the day to monitor ourselves. So the woman is using the day to monitor herself. Every time she goes to the bathroom, before she passes urine, she checks whether there is any wetness and what kind of wetness she has. And if by evening she is still dry, she hasn't noticed any mucus, or if what the secretion she is finding is the gummy, pasty one and not the slippery mucus of fertility, then she is free to have sexual intercourse. But what if they were tired and didn't have sex, and early in the morning they feel like having sex? The danger here is that she has been lying down for 6 hours during the time she was asleep. The birth passage could be full of the mucus of fertility and she has no idea. Now, if she were to run to the bathroom and check, she would still find she's still dry. Why? Because the mucus of fertility is very heavy. And until she's up and about for at least maybe 6 hours or so, that's when gravity is able to pull down the mucus and she experiences the wetness. So the birth passage could be full of mucus, but she will only feel the wetness at noon the next day. That is why sex in the morning is a very bad idea if you're using natural family planning. So evening only would be the best principle. Rule number two, no daily sex, which means you skip a night or two. Why? If the woman had sexual intercourse last night, then the whole day today she will experience a wetness from that act of sexual intercourse and would need liners. And that secretion after intercourse is very slippery also. And she'll still be feeling it in the evening when she is going to bed. How would she know if her fertility has also come? Because things are now confused, the best principle is don't have sex the second night, allow that night to pass so that the next day, if the woman spends the whole day dry, then the couple understands that the wetness she was experiencing was from the sexual intercourse. But if she remains wet a second day, it would mean that her fertility has actually come. So those two rules are very important to ensure that the couple does not have sex when they have the mucus and yet they did not know it was present in the birth passage. Now, when we talk about sex in the night. You can have sex 2 times, 3 times, that's your problem. But then the next day, you would avoid sexual intercourse. The other two rules are because of confusion that can be brought about by changes in the secretion of the birth passage. So if there is any bleeding, even spotting, or just wetness of blood, then the couple should avoid sexual intercourse. And why? Because sometimes when ovulation happens, this mucus of fertility can actually come blood-stained. And a woman may think it is her period starting, yet it is fertility. The other thing is that if you remember this very short cycle that we had, this cycle of 21 days, if a woman has her periods for about 6 or 7 days, and she's going to get a short cycle, then the end of the periods and the beginning of the mucus actually mix, and the woman can actually get pregnant when she has her menses. In fact, for couples with very short cycles, like 21 days, with a woman who has long periods, we encourage them to have sex just at the end of her menses when they're trying to get pregnant, because they may keep missing their fertility. So that is the second rule. The third rule, sorry. The last rule is if there is any unusual change in the vaginal secretion, if the woman notices something that is unusual, it is not the mucus of fertility, it is not bleeding, it is something else, or it is some mucus and she's not sure because it is not changing the way the one of fertility changes. The right thing to do is to stop any sexual activity and wait and observe until a period of at least 3 days has passed, 3 dry days have passed, so that in case that wetness had anything to do with fertility, it has passed. And therefore, you allow 3 dry days so that in case that mucus was anything to do with ovulation, then the acidity will have come back by the fourth day, and then the couple is free to continue with their relationship. So those rules are very, very important, and they're the ones that give guidance. Now, this part of the cycle where fertility is over, from the fourth day of the cycle up to the menses, are actually infertile. But in my experience, I have found that when couples get excited about this, it is possible for them to get pregnant because of being careless about their fertile window. I therefore encourage couples to use these four rules, whether it is before the mucus or after the mucus. Now, if you have used those four rules as a couple for a period of 3 months, 4 months, and both of you are able to identify the seasons of the menstrual cycle, that the man can tell the mood swings and mood changes of how the woman, when she's fertile, she's getting her periods, and that he can tell when she gets excitable around the time of her fertility. If both the man and the woman are very clear about this fertility, then it is possible to assume they cannot get pregnant this part of the cycle. However, I would encourage that these rules are used both before the mucus and after the mucus for a long enough period for the couple to be confident. So that is the scientific basis of natural family planning. There are a few other bonuses for people who have 4 children who are girls or 4 children who are boys, and they would like to see whether it is possible to get a child of the opposite sex. There is some science to getting a boy or a girl, but it is also important to put a disclaimer that it is not always 100% successful, because God will always give the final reward. It is Him who will give the child. We can try to influence, but we cannot reject the gift if it is not what we had anticipated. So long as you're in that right state of mind, then this is the science. The sperm that carries the Y chromosome, which gives us the boy, is slightly smaller, so it moves faster, but it dies early. The sperm that carries the X chromosome is a little heavier, it is slow, but it lives longer. And we know that the egg is alive for only one day. Now we know fertility is a period, is not it's not an event. Ovulation is just one day, but the duration of fertility can be 4 to 6 days. Now, on which day the egg is released during those 4 to 6 days remains God's secret. And that is why he is the final giver. So we know the woman is fertile for 4 to 6 days, but we do not know exactly which day the, the, the egg will be released. Now, if you understand this, then it means if we could know when the egg is being released, if we knew the day of ovulation and the couple had sex on the day of ovulation, then it means it is the Y chromosome that will get to the egg first, and therefore the baby will be a boy. Now, if we knew the day of ovulation and the couple had sex 1 or 2 days before, then the male sperm will have died, and it is the female sperm that would get to the egg first, and therefore they would get a baby girl. The challenge is that we do not know the day of ovulation. So that's why there is a system. Now, assume a couple has noticed that this month the mucus has lasted 3 days. It would then mean that the window of fertility is 6 days. So they can be able to tell when the window of fertility will end. The last day of fertility will be day 6. Now, if we are trying to get a baby boy, what the couple will do is that as soon as they see the mucus, they avoid any sexual activity and count how many days of fertility they have, and they only have sex on the very last day of fertility for that month. So they are following the rules before. The minute they notice the mucus, they abstain, and on the last day of the fertile window, they have sex just once. Now, after that, it doesn't matter what they do. Now, if the periods come, it means that the woman did not ovulate on day 6. Therefore, the next month, they do the same thing. They follow the rules. When they see the mucus, they avoid any sexual relationships. But this time, they try on the second last day of the fertility. Again, if her periods come, they do the same thing the next month. But this time, they try on the 4th day of fertility. And they keep doing this until the woman misses her periods. Now, if this instruction is followed and the woman misses her periods, then chances are that they had the sexual relation on the day of ovulation, and that gives us up to a 90% chance of getting a baby boy. If it is a baby girl they are looking for, then immediately the woman notices she's fertile, they would have their first sexual relationship and then avoid having any sex until 7 days later when the window of fertility is most likely over. Now, if she gets her period, it means she did. The idea here is they're having sex at the beginning of the mucus so that the period, the male sperm is dead before the ovulation happens, and yet we don't know when it will happen. Now, if she gets her periods, then the next time they try the second day of the mucus, the next time they try the third day of the mucus, and if they get pregnant, then chances are that it will be the female sperm that will have ovulated the egg, and there's a 90% chance of getting a baby girl. Now, women who have a very short mucus of only one day generally tend to have baby boys because immediately they discover they are fertile is also the same day that ovulation tends to happen, and it's very hard for them to get baby girls. Women who have mucus for 2 to 3 days have a chance of getting both boys and girls. So the most important thing to remember is that when you're trying this, during the fertile window, you only have sex once. So if you're trying for a baby boy and this month you have had sex on day 4 of the fertile window, then avoid these other days so as not to put in other sperm that may have the different configuration of the male female. So that's how the science for trying for baby boy and baby girl is works. Remember, in the end, the giver of life is God. You have tried your best, and God has decided you will never raise a baby boy or you will never raise a baby girl. It is not failure on your part. It is God's will. So thank you very much. I'll stop there and allow questions.
Thank you very much, Dr. I've really enjoyed the session and I've learned a few things. Fertility is 4 to 6 days, assuming period runs for 4 days. The period runs for 4 days, depending on how long the milk has lasted. I'm not very sure if I got it right, but I leave the rest to God. Then paying attention to the body changes. I don't know how social media influences us and stress in the office and the food we are eating will influence this and will enable us or not enable us to pay attention to the body changes. There's another thing, calendar will mislead us. And then there are rules that can be used to achieve a particular goal, but God has the final say. So thank you for those insights and a number of insights you've shared with us. There are now a few questions on the chat. So I'll start with Lillian. Lillian is asking, can you comment about natural family planning and perimenopause? And then Kyoko is asking, how long does the sperm live in a woman's body? Kindly also comment on vasectomy. So like 3 questions there. Then we can go to the next set of questions.
Okay, so natural family planning and the perimenopausal period is also very similar to natural family planning and the period after giving birth. So it's important that we keep in mind that it is the fertility we are focusing on, not the periods. So long as the woman understands it is the wetness of fertility she is looking out for, then she will always be able to use the natural family planning. Where it becomes a challenge is where she has been taught to use periods to decide when she is fertile and when she is not. So when the periods stop or they delay, there is a risk that she may make the wrong choices. So if you remember those 4 rules, if the woman doesn't get her mucus and doesn't get her periods, then you continue using the 4 rules until whichever comes first. If it is her periods that come, then we go back to the 4 rules. We are waiting for fertility. If her fertility comes, then you allow the 3 dry days to pass. And from the fourth dry day, you continue using your rules. So that's why this is very powerful. It can be used even in women who have irregular cycles, like those who are premenopausal and those who are breastfeeding. But the counting method cannot be used in those circumstances. Now, the sperm, how long it lives, maybe he joined us a bit late. We had said that the birth passage of the woman of the vagina is acidic in its natural state, and that acid will always kill the sperm. But when the mucus comes, the mucus is alkaline, it neutralizes the acid, and it also keeps the sperm alive for 3 to 5 days inside of the woman. So it is the mucus that is the secret, not the number of days. Okay, so long as the mucus is present and baby is small, you respect it the same way you would respect Zakayo. Make sure you don't touch until the mucus is over and the 3 dry days are over. Otherwise, there will be a little gift which you will accept and look after. Vasectomy is male sterilization. The vas, The tube that carries the sperm from the testis to the urethra is actually tied, and it is cut and divided and separated. Therefore, the sperm can no longer get out into the urethra to get into the woman. So it is sterilization. It means the man's sperm can never get to the woman. Now, there is a big challenge because the way the body is structured is that so long as the um, testes do not empty, so long as a man does not have sex, then the industry reports to the brain that the factory is full and we have enough reserves, so stop producing any more sperm. So the sperm production stops and will not start again until the man ejaculates. So what happens is that so long as you're not having sexual intercourse, the industry goes quiet and waits until there is empty. And that's just a safety mechanism. Once you block the passage, you are blocking the exit from the factory. The minute you have sexual intercourse and achieve orgasm, the body assumes that you have emptied the factory and triggers production of more sperms. And what happens is that we have a backlog. There is more and more sperm being produced, but it has nowhere to pass through. And that eventually damages the system that make the sperm, which is very special. The sperm are not supposed to mix with the blood system because a man would then develop antibodies against his own sperms. So because of the back pressure that happens in men who have vasectomy, and there can be that rupture, and some of the sperms may leak into the blood system, and therefore the man develops antibodies against his own sperm. That means that even if you were to try and reverse this, even if it is very difficult, whatever will come out will never work because the man has produced anti-sperm antibodies. But the other thing that is a little more worrying is that those anti-sperm antibodies are also known to attack the large blood vessel called the aorta. They attack the inner lining of the large blood vessel called the aorta because they are self-antibodies and there are some molecules that would be similar, and that can actually cause issues with clotting and damaging of the aorta later in life that can have complications to the man. So those are the first three questions.
Thank you very much, Daktari. There are two other questions. So Kate is asking, can fibroids shrink? And then there's another question related to that. From Mary, thank you for the session, Dr. Wahome. Once fibroids have been removed, how long can one wait to get pregnant? This is assuming the menses are regular.
Okay, that is outside today's topic, is a bonus. I have not come across anything that would shrink fibroids, and I am very liberal to a point where when herbalists or natural medicine practitioners claim something, and I have a woman who is struggling, I sometimes encourage them to try. But I have tried even those who have come and said they have um, natural medicines that can shrink fibroids. I have not come across any of this in my 20 years of practice as a specialist or my 30 years of practice as a doctor. Now, they tend to grow slowly and they are not cancerous. They generally would not become cancerous. It's very rare for fibroids to become cancerous. And when we try to remove them, there is always a small risk that we can lose the uterus. So the best advice for somebody who has fibroids that have just been noted on ultrasound, but they have no pain during periods, they are not bleeding very heavily, and they're not having any challenge whatsoever. They were just found by accident because somebody was doing a scan. The best advice is that it is best that you start your family and then get your children as quickly as possible and then wait. If the fibroids never give you problems, you may never have to have surgery. But if you have to have surgery for fibroids, at least you have the babies in case there is loss of the uterus. Otherwise, where the woman has a lot of pain during her periods, I was not there before, she's bleeding very heavily, or the fibroids are so large they are compressing on the internal organs, especially the drainage system of the kidney, then the woman would need surgery just for her own health and not for anything else. We try very hard to save the uterus, but we cannot give any guarantee. Now, fibroids removed after surgery. Now, if the fibroids were deep in the uterus and especially causing heavy bleeding, it means that when we do the surgery, we have to cut through the full thickness of the uterus to get to the endometrium or the cavity where the baby grows. And therefore, that scar is so deep that that woman should be told that the safest way for her to get her children would be through cesarean. So the first thing is, if you go through surgery for fibroids, always ask your doctor whether he needed to go deep enough to get to the cavity of the babies so that you know that you would have to have cesarean with all your pregnancies, or whether the fibroids were on the outside or dangling on the top of the uterus, which then means they do not affect how you deliver your baby. So that's number one. Number two, any scar of the uterus. There has been a lot of stories about how long we should wait. Some people are saying 2 years, some people are saying 3 years. Whether it is fibroids, whether it is a cesarean section, there had always been a big debate. There is somebody who did a study and he went collecting the uteruses of women who had lost their uterus for various reasons but had had a cesarean section. And he looked at the scar and he found that after 2 months, the scar is fully mature and would not change regardless of how many years passed. We also know that the scar of the uterus, especially where it is a cesarean scar, does not start being stretched by the growth of the uterus until about the 7th month of pregnancy. So for cesareans, even if a mother was to conceive immediately after the delivery, there would be no danger to her or the baby, except the fact that if the cesarean was done for something that repeats itself, then she would need to have a cesarean. So I've seen women who have conceived 6 weeks after the previous baby, after a cesarean section, carry pregnancies to term safely. Now, the challenge with myomectomy is that we cut many different places. So when we're removing the fibroids, we don't cut the same place as the cesarean. We cut where the fibroid is. So generally, from understanding of the healing of the scars, at least 2 months minimum should pass before the woman considers pregnancy. So beyond that, it depends on how they feel and whether they are comfortable enough to resume sexual intercourse. Those other things would be personal decisions.
Thank you, Daktari. I think the last questions, one from myself, one from Diana. If you have another question, please raise up your hand, then we can give you a minute, but time is not on our side. And our moderator, Ben Sakwa, will be giving us the vote of thanks and also final prayers. So Diana is asking, with the current economy, I think it makes sense to manage the number of kids they have. Are there other options you can recommend in addition to natural family planning to avoid many unplanned pregnancies? I'm asking about a scenario where a 19-year-old girl has not developed the breasts, no periods yet. What could be the solution for such a girl? Thank you.
Okay. So the issue about spacing of the children is also addressed as responsible parenthood. That it is good to allow the mother to heal. It is also good to allow the baby to grow and be a bit independent before the other child comes. Sometimes couples will start their families late and will agree to have a child every year and get the number of children that they desire. Every family has a different way of dealing with these issues. But the economy being the reason for getting fewer babies is something that has been used more as an excuse. I think it's better that couples say that they would want to have few children. Um, our immediate vice president, Rigathi Gachagua, told us how he regretted having two children. So you have all this money, but you got two children because you're worried about the economy. I ended up with three children, and the challenge here was that in school we had been told that if you have more than three children, you're going to become poor. In fact, the issue was two children. And we were traumatized psychologically and made to believe that we are irresponsible if we have more than two children. And now I look back and I would have easily been able to raise five children. And it is very unfortunate. My own parents, we are 11 of us. None of us slept hungry. We were not rich, we were not poor. And I think it is the moral values you put in your children that are more important than the amount of money you spend on them. So it is a give and take situation, but that we are called to be responsible to allow the baby to grow a little before the other one comes. That is certainly true. And that is why the church encourages the use of natural family planning. Now, in about other methods that can be used, there are many other methods, and there are contraceptives and many other things. Now, I usually don't discuss them. I don't offer them in my in my clinic because they are not part of medical practice. Medicine is the treatment, diagnosis, treatment, and prevention of disease. Pregnancy is not a disease. So anything that prevents pregnancy could be a drug, but it is certainly not a medicine. So contraceptives are not medicines and they hurt women and are not part of medical practice. So if one would desire to know more about them, then they need to go and look for those who offer them. They would be available. Now, the reason the church impresses upon us to avoid contraceptives is one, because it objectifies the woman. We are saying as a couple that we want to have so much sex that children are a hindrance. And therefore, the gift of giving birth is a very nasty thing, and pregnancy is a bad side effect of sexual intercourse for fun. It changes the attitude of the people, and it actually hurts marriages, and it increases the rate of divorce amongst couples. The men get to feel that they are not responsible for pregnancy, and therefore, if the woman gets pregnant, she is blamed for being disorganized, and she is supposed to sort herself out. And that kind of attitude of men objectifying women becomes a natural product of contraceptives. Now, if one is using a contraceptive to have sex for fun, but then conceives a baby, then that baby is then called unplanned. But you see, naturally, if you know that sexual intercourse can give you a baby, to tell us you're surprised you're pregnant is being untruthful. What did you expect? It is one of the outcomes. So you can't call a baby unplanned, yet you had sexual intercourse. It is ridiculous to use that kind of a term. So the baby is not unplanned. The baby came because you had sexual intercourse. And there is a responsibility of parenting towards that child. So when we call babies unplanned, then we have a risk of considering abortion as a solution to unplanned pregnancy. And that is why the introduction of contraceptives quickly follows divorce. It quickly follows the use of contraceptives. It quickly follows the demand for abortion. That's the danger, and that's what the church is trying to prevent. Now, a 19-year-old child who is a girl, who has not grown breasts yet, or who has no periods, would require to be evaluated because it is abnormal. It is not normal. And what we usually do is an ultrasound to check whether she has a uterus and the ovaries. And we then can check the genetic profile to check if the genetic profile is normal. So one of the conditions we worry about is called testicular failure or androgen insensitivity. So this is a baby boy. The genetic material is XY, but then the physical body does not respond to the hormone, the male hormone called testosterone or the androgens. And what happens if the body does not respond to androgens, it becomes female. So the baby is born with features of a female. The genitals look female, but if you examine closely, you find that the vaginal passage is just a little dimple. When you do a scan, you find that there is actually no uterus and no ovaries. And when you do the genetic profile, you find that they were actually supposed to be boys, okay? So it's very important for that child to be assessed to check for androgen insensitivity and then check whether there is a developmental disorder. So those are called disorders of sex development, and that child needs thorough assessment.
Thank you very much, Dr. Time is not on our side, so we'll not go into any other question. Lillian has asked a question which I think Dr. had already responded to, but I think, Dr. you can put your contact so that people who have follow-up questions can still reach out to you. I'll ask our moderator to give the vote of thanks. Thank you very much, everyone, for attending. We have this every last Friday of the month is one, we call it family enrichment session, and we tackle different topics. I want to believe that the men in the room were also challenged. There is one title that I normally like, the HOM, Husband of Mercy. So I hope our men in the room can also introduce some title, courtesy of this session. Ben, you can take it over. And Ben is here with the Edel. So you can lead us on vote of thanks and final prayers. Thank you. Dr. has shared his contacts on the chat box. For people who are asking about recording, we've also given you our YouTube channel. You'll just subscribe. You'll be notified when it is posted. Thank you. Ben is unmuting himself. Ben, you are there? Okay, let me see if I can unmute you if you're not able to unmute yourself.
Can you hear me?
Yes, thank you.
Okay.
Go on.
Thank you so much.